Hello everyone, I'm Dr. Ayesha Ansari from 108 hands-on batch. I have two questions for sir. First of all, it's in the continuation कि I have applied for level 1 registration, but because of the delay of the bureaucracy हमको नहीं मिल रहा है अभी तक registration. तो whether I can start stimulating my patients, not doing IUIs, but can I start stimulating?
So one thing is, I've been in the army for a long time, a bit of bureaucrat myself. So never use the term called bureaucracy.
Okay.
Understand that they know. I'm not talking. There's no state board in Patna. There is no Bihar, no state board in UP. And I personally myself sat with the most senior-most people in the state who have to sign, highest level people. Even they are trying hard. So when bureaucrats, they don't do a thing, there is some reason for that. I mean, they are trying to work up something. But the question is correct, that in case you don't have the state board, Noida doesn't have a state board because UP का state board नहीं है. UP का state board ही नहीं है. अब how do they practice? You can't practice. So what you need to do is, government is very, very friendly to us. The present government is very friendly, but they wanted to follow a pattern. So what you guys do is that you apply to the state board, pay the money. Money has been paid, the file has been sent to the state. You are being inspected by your local chief medical officer.
Right.
There is a district medical officer,
yes,
or DMO.
Yes.
But you pay money in the state.
Right.
So suppose she is in Mumbai. अब मुंबई का स्टेट बोर्ड यहाँ पर भी होगा, वो एक स्टेट बोर्ड होगा, बट डिस्ट्रिक्ट्स विल बी मे बी 200-300.
Yes.
They are being controlled by the district medical board or chief medical officer, yes, who have put somebody to look after how you work. So after you pay the money to the state board, then you can take that file. File तो मिलेगा नहीं आपको, but you have a receipt.
Yes. You
can go to your chief medical officer, tell him, sir 6 महीने हो गए, अभी मैं क्या करूँ? And normally they are very nice people. They will say, state board तो बना ही नहीं है, काम तो करना है, बोलेगा तो काम कर ले. They normally allow, but you should not do anything without taking permission of your chief medical officer. State medical board will give you, as per the regulations, they are following the rules. To regulate the rules, they have made a policy. Okay, for all the major complaints, they are responsible. Taking money, they are responsible. But for implementing the policies at district level, it is the chief medical officer. Because how do you expect somebody sitting in Lucknow coming and seeing CMA's unit? They cannot come, because they are in Lucknow. They will tell her CMO, file आएगी, if file will come to the CMO, check her unit. So for all the complaints, all the local running around is done by the CMO of your district. State board, you don't even know who you are.
Okay.
So now you have to go to the state medical board, your CMO, and tell him with all the papers, what do I do? And normally they will say, okay, you go ahead. So they'll give you permission. And it's a verbal permission.
Yes.
They can't give you the formal permission without checking your center.
Okay.
Paying money is not the criteria for you getting, yes, a certificate. You got a form 3, no? There's a form 3 which you, yes, get. So form 3 will only get after your CMO sees your unit and then sends that file to the state board. State board approves it. And then that file comes back to your CMO, and then probably they can issue a US certificate, or state board can issue a form number 3. Without that, you cannot start your clinic officially. You're always been doldrums. So take permission of your state board, verbal permission, they'll normally won't, or your CMO, they won't say no. But on your own, you're not allowed to do this, because as per after the implementation, after 7th of June notification, ये नहीं कि अपना clinic खोला और काम करना शुरू कर दिया. You can't do that.
Also, sir, can I register level 1 at 2 places, 2 different places?
There's no rule. You can do it at 10 different places.
Achha, okay.
But PNDT only at 2 places.
Yes.
You want to have in Mulund, you want to have in Kalyan, you want to have in Thane or Kolaba. No problem. You're a doctor.
Yes.
They are different units. They have not said that you can't register. But PNDT तो आपको They won't give you. You can't do ultrasound machines. Doctors have visiting chambers. No, doctors have visiting. You can do IUIs.
Yeah.
IUIs, but you
not
can't do
sonographies.
ultrasound. Yes, that's the point.
And even if we are practicing microfluidics, but still जो regulations है level 1 के
सब चाहिए.
microscope,
Same with
refrigerator,
me.
centrifuge
Same
सब
with me.
चाहिए.
I only do microfluidics.
Yeah.
I only do microfluidics in my OPD.
Okay.
But I have to keep everything because I don't want to waste my time on centrifugations. I use microfluidics and I do my IUIs, but equipment MRC is required.
And so one last question about sir, when we are doing an embryo transfer cycle, you taught us about loop ride, that is 4 mg in 4 ml. So sir, can we also give leuprolide depot 3.75 prior to starting the transfer cycle, like day 21, 22?
But I have never told you to give leupride for transfer cycles.
Achha.
Only in 2 cases I have told you, when somebody has got gross endometriosis,
Yes.
or somebody's got PCODs. There I say you may give.
Yes,
But not
only
as a routine.
in those conditions.
Otherwise, ma'am, I don't recommend.
Yes.
Otherwise, no down regulation. As far as natural they'll go, you'll have better outcome. But when the PCOs have got, they are hyper secretors of LH.
Yes.
They have high E2. There I say you may give in case ET doesn't form.
Yes.
Or endometriosis, or adenomyosis, when you'll
Yes.
find small budding of the endometrium occurs. There you can do it, but not as a routine.
But instead of leupride, we can also give depot formulation, no?
You can, but depot is uncontrolled.
Achha.
Depot is uncontrolled. I always like to control things by giving a which will have a predictable washout from the body.
Okay.
A depot will be long lasting. I don't know how will it last. So giving daily injections is what I prefer, but many people give depots also.
Okay. Thank you so much, sir.
Okay.